It's been reported today that some GPs are seeing up to 60 patients a day. That is double the amount that they consider safe, as services struggle with staff shortages and a rising demand for care. Patients are now waiting for up to 3 weeks for an appointment. So what is going wrong and what can we do to fix it?
I think doctors are really overworked, but this figure that's been in all the headlines of doctors seeing up to 60 patients a day only applies to 1 in 10, but it is shocking.
Yeah.
I think the average number of patients a GP sees is about 40 or 41.
Yeah.
They think that the right number should be 30. So they're really, really overworked. And it made me think, how have we got to this situation? Obviously, one of the reasons is that young people are training as doctors, but then they don't want to be GPs. A lot of them are going abroad or they're specialising. I had supper last night with a friend of mine who's specialising in tropical diseases, and, you know, he could have been a GP, but he didn't want to be. I think we have to ask ourselves, we're an ageing population. A lot of the patients now have got complex needs. They've got more than one thing wrong with them. They require more time and more input. We've got to give something up. We, as the patients, in the short term, have got to decide, what do we want from the National Health? Will we pay for some things? Should these things be means tested? And should doctors be seeing all of us, you know, every time we want an appointment? Should there be more specialists in surgery so we can go along and not necessarily have to see a GP?
Yeah, it is such a interesting way of looking at things. You're right, we do need to, instead of going, oh gosh, I've had to wait 4 weeks for an appointment, which happens to lots of people all the time, we have got to look at it and go, OK, so what's the solution? How can we all chip in to benefit our NHS? And when you were talking about earlier, the sort of, can we pay for GP appointments? Can we see if it's means tested? There are certain things that perhaps you or I might be able to pay for when it comes to maybe a full MOT or, you know,
so would you like, I don't want to talk about you like a car, but imagine your body's a car and you had an annual MOT service.
Yes.
Do you think that's a better use of all the visits and all the anxieties you have all throughout the year?
Yeah,
going
I
once
think
a
that
year
it would
and have a kind of
probably
service.
stop me from being, you know, being so quick to call up the GP when I see something, because I would know more about my body.
Yeah.
But I don't think it should just be for people who can afford to pay for it.
Yeah,
there's got to be a system where we look after everybody and we say, right, everybody deserves that kind of health care. It will put lots of people's minds at rest. It will make us know more and understand more and be more educated about our bodies. And perhaps then we won't see such an influx of people going to the GP every single day.
But do you think, I mean, the health service is expanding and changing in so much as even I personally have had leaflets coming through the door recently, I don't know if any of you have had the same, where there's different services now being offered, whether it's mental health or otherwise, where you can self-refer rather than having to go to your GP every single time to get a referral, which can clog up the system. You can then refer yourself. So they are making subtle changes.
They are, but the biggest problem that we've got in this country, if you want any of those issues addressed, is that we don't have enough people in the industry.
No.
So, I mean, the government have said that they want to increase the number of health professionals in GP surgeries by 20,000, including physiotherapists and pharmacists and mental health workers. Now, I'm really sorry, but we're having the Brexit talks at the moment.
Yeah.
You know, Europe is a big contributor to our National Health Service, and we weren't really made aware of that when we vote for Brexit, etc.
In terms of staff?
In terms of staff, nurses, you know, there are doctors, all those people, but also immigration. When we look at immigration, everybody goes, yeah, we don't want immigration, we don't want the foreigners over here. I'm really sorry, guys, but a lot of our future doctors and a lot of our future nurses and mental health workers, they are going to have to come to this country from abroad.
But on the flip side of that...
In terms of immigration, you know, I understand we're a small island, but on immigration, I would say we need a system where we allow professional, skilled workers on point systems to allow us to run the services that we want adequately. It's really important.
But picking up on that point, some people would argue that actually it's immigration itself that's the problem, because there are too many people who are asking for help, who some would say aren't necessarily entitled to it, and are flooding the system.
Well, I haven't seen the breakdown of the number of people of colour or of different backgrounds or whatever that immigration
I'm not
has
saying necessarily of colour. I'm just saying that aren't necessarily from the UK.
But I haven't got a fact that immigration has led to that. I do know from my own personal experience, I've seen people with a cough, with a little bit of an infection, with a little bit of this, a little bit of that, and they go in and you go, but but why aren't
one
you
of the reasons
self-diagnosing
is
that?
You won't be treated on the NHS, as far as I'm aware. My sister, who's a nurse, if you don't live here and you don't have a national insurance number and you're not registered, you won't be treated. They'll do what they can, but then there's only a certain point you can go to. But also picking up on the point about, you know, making sure that we don't allow people... We want people to come over and learn. There's also a massive part of people that come here to learn because it's cheaper to get the degree in nursing or in doctors or whatever over here and then go elsewhere because the NHS doesn't pay enough for the staff. So there's massive flaws all over
But the other
system.
thing is that people do go to the doctor for things which are minor
like
anxieties.
coughs
And we do live in a situation where every day you open the newspaper, you read online another scare, another health scare. We all spend every day examining ourselves for lumps and growths and moles that have changed size. And we've got to somehow...
Not be too scared.
Not be too scared. And perhaps, you know, adopt some of what I said earlier, which is regard servicing your body and treat your body as something you have to look at once a year and get you reassured.
Do you ever think we've gone too far with that? I think it's so important to raise awareness and, you know, and to make sure everybody knows how to check themselves properly. But like you said, do you ever feel like every other radio advert, every other TV advert, every other magazine article is something telling you that you've got to look out for something very sinister? And that does maybe push people into going and getting extra checks and going in... Do you think, is there a point
People
where...
are more anxious, without a doubt, but at the same time, people have got to take charge of their own lives, their own bodies and their own health. I mean, we've got to eat healthily and exercise more, and then we'll be living longer and have more, you know, feel better about ourselves.
I think it comes down to responsibility, doesn't it? I think we take responsibility for our bodies in terms of trying to stay as healthy as we can, so that is our own responsibility, but also it's that balance of, yes, we do need to check ourselves. If there's anything that we're concerned about, the GP is our first point of call. So if you are concerned about anything, whether it is a lump or bump or mole or anything like that, do still go to your GP because that is what they're there for.